Today, we're continuing with our How Not to Die series, and we'll be discussing the topic How Not to Die from Infections. And we're continuing with the book How Not to Die. Discover the foods scientifically proven to prevent and reverse disease. And it was written by Micheal Greger. Hello and welcome to Pharm Glo's Clinic, your number one stop for everything on health and wellness. Make sure to subscribe to this channel and don't forget to click on the notification bell. Also, please give this video a big thumbs up, and if you ever have any concerns, questions, or opinions about the video, don't be shy. Just leave a comment down below. Now let's get into the video. Because of humanity's dominance over animals, a veritable Pandora's box of contagious diseases has been opened. Before domestication caused a widespread of animal diseases into human communities, the majority of infectious diseases that affect humans today were unknown. For instance, tuberculosis, which now affects approximately 1/3 of humanity, appears to have been acquired initially through the domestication of goats. Meanwhile, it's possible that mutant cow viruses gave rise to measles and smallpox. Domesticating pigs resulted in whooping cough. Domesticating chickens brought about typhoid, and domesticating ducks brought about influenza. Leprosy and the cold virus may have also originated in horses and water buffalo, respectively. How many times did the horses have to sneeze into our face before they were broken and bridled? Before then, the common cold was presumably common only to horses. Pathogens can spread from person to person after they cross the species barrier. AIDS is brought on by the HIV virus, which weakens the immune system and is assumed to have originated from the slaughtering of primates in Africa for the bushmeat trade. The significance of robust immune function is illustrated by the opportunistic fungal, viral, and bacterial infections AIDS patients acquire, but to which healthy people are resistant. Your immune system fights for your life every day against the pathogens that are outside of you and inside of you, not just when you're sick and running a fever in bed. You inhale thousands of bacteria with each breath, and you have the potential to consume millions more with each bite. It really is a scary world out there. Although the majority of these microscopic pathogens are absolutely harmless, some of them have been known to cause dangerous infectious diseases like SARS and Ebola. Even though many of these exotic pathogens garner a lot of press coverage, some of our most widespread infections claim more lives. For instance, each year over 57,000 Americans pass away from respiratory illnesses like influenza and pneumonia. Remember that you don't necessarily need to come into contact with a sick individual in order to contract an infection. It's possible that you have latent infections inside of you that are ready to attack if your immune system starts to fail. Because of this, washing your hands alone is not enough. You also need to have a strong immune system. The key to preventing infectious diseases is to build a strong immune system. The name immune system is derived from the Latin word immunis, which means untaxed or untouched, because the immune system defends the body against external invaders. In comparison to the neurological system, the immune system is the most sophisticated organ system that exists in humans. It is made up of a variety of organs, white blood cells, and proteins called antibodies that work together to fight invading pathogens that pose a threat to the body. But as you age, your immune system begins to deteriorate. Is that just a natural consequence of becoming older? Or it might be that older populations also exhibit a decline in dietary quality. 83 volunteers between the ages of 65 and 85 were divided into two groups to test the hypotheses that poor diet may contribute to the decline in immune function with aging. The experimental group ingested at least 5 servings of fruits and vegetables each day, compared to less than 3 of the control group. Then they were all given the pneumonia shot, which is advised for everyone over the age of 65. Your immune system will be prepared to create antibodies against a particular pneumonia infection as a result of vaccination. After only a few months of consuming just a few more servings of fruits and vegetables each day, persons who ate 5 or more servings per day had an 82% stronger protective antibody response to the vaccine compared to the control group. And that is how much impact the fork might have over immunological response. The immune system can receive an additional boost from the intake of several fruits and vegetables every day. So now, what fruits and veggies should you take to help improve immunity against infectious diseases? Kale. In addition to being one of the most nutrient-dense foods in the world, kale is a dark green leafy vegetable that can also assist the body fight infection. About 1/1,000,000th of a gram of kale protein was applied by Japanese researchers to human white blood cells in a laboratory dish. Even that tiny amount caused the cells to produce their antibody levels to quintuple. One important question that people always ask is, does kale lose its immune-boosting properties when it is cooked? Well, it turns out that even cooking the vegetables non-stop for 30 minutes will have no effect on the production of antibodies. The cooked kale really seems to work even better. Mushrooms. Do you ever experience seasonal allergies? Sneezing, itchy eyes, and a runny nose? While having allergies may make you feel miserable since your immune system is overworked and attacking everything in its path, the same level of vigilance may be advantageous for your general health. Allergy sufferers tend to have a lower chance of developing several cancers. Your immune system may be working overtime, attacking trivial things like pollen or dust. But the same vigilance could also be eradicating the body's emerging tumors. If only there were a method to increase the immune system's capacity to combat infections while reducing its capacity to cause chronic inflammation, that would be nice. Well, mushrooms may just do the trick. Yeast can be compared to single-celled mushrooms, such as algae can be compared to single-cell plants. The annual commercial output of edible mushrooms is in the millions of tons globally. However, other than some B vitamins and minerals, there isn't much to be found on the nutrition label of a carton of mushrooms. Is that all mushrooms have? No. There are a variety of special micronutrients that may improve our immune system's function that are not included in the list. Australian researchers divided some participants into two groups. Each day, one group consumed its normal food, while the other consumed its normal diet plus a cup of cooked white button mushrooms. The IgA levels in the saliva of the mushroom eaters increased by 50% after just 1 week. Before dropping, these antibody levels were elevated for almost a week. Therefore, aim to incorporate mushrooms consistently into your diet for long-lasting advantages. And hold on, shouldn't we be concerned that mushrooms may aggravate the signs of symptoms of autoimmune or allergy disorders if they cause such a substantial increase in antibody production? On the contrary, it seems mushrooms may have an anti-inflammatory effect. A variety of mushrooms, including plain white button mushrooms, have been reported to appear to limit the inflammatory response in vitro experiments. This may cause a boost to immunological and anti-cancer function without worsening illness or inflammation. In children with a history of recurrent upper respiratory tract infections, the first randomized, double-blind, placebo-controlled clinical research of its kind, published in 2014, demonstrated an apparent anti-allergy benefit. Other important foods to help you prevent colon cancer include broccoli, berries, and beets. Another way to improve your immune system is to exercise. Exercise can boost your immune system and can achieve a 25 to 50% reduction in sick days. Also, it has only good side effects. Additionally, you don't need to work out very hard to see benefits. According to studies, children's blood levels of immune cells grow by over 50% when given just 6 minutes to run around. Regular exercise can also help prevent age-related immunological decline at the other end of the life cycle. According to one study, aged, inactive women have a 50% chance of contracting an upper respiratory infection during the fall, and those who were randomly assigned to start a daily half-hour walking program had a 20% chance of contracting the sickness. However, among the trained runners, the risk was only 8%. Their immune system looked to become more than 5 times more effective in warding off infection after exercise. So what are you waiting for? Get up and start moving. And that's all for today. What do you think about the video? Let us know down below in the comments section. And that's it for today. Be sure to subscribe to the channel and click on the notification bell. Smash that like button and I will see you in the next video.